Delays in milestones. Children may exhibit delays in reaching developmental milestones such as rolling over, sitting up, crawling, walking, talking, or other key markers in physical, cognitive, or social development. Communication challenges. Early signs may include limited or delayed speech and language development, difficulty understanding or following instructions, or challenges with nonverbal communication like making eye contact or using gestures. Social and emotional difficulties. Children might struggle with interacting with others, forming relationships, or understanding social cues and norms. They may exhibit unusual behaviors or have difficulty regulating their emotions. Learning problems. Some children may have trouble with learning tasks such as recognizing letters, numbers, or shapes, understanding concepts, or acquiring new skills. They might experience difficulty concentrating, remembering information, or following directions. Motor skill delays. Difficulties in fine motor skills, grasping objects, using utensils, buttoning clothes, or gross motor skills, walking, running, jumping, may be evident. Sensory sensitivities. Children could be overly sensitive or under-responsive to sensory stimuli, such as light, sound, touch, taste, or smell. They may exhibit unusual reactions or seek out sensory stimulation. Behavioral issues. This might include aggression, impulsivity, hyperactivity, self-injury, or repetitive movements or actions. Regression. In some cases, children may appear to lose previously acquired skills or abilities, such as language or social skills, which can be concerning. Risk factors for developmental disabilities. Genetic factors. Some developmental disabilities have a genetic basis and may run in families. Examples include Down syndrome and Fragile X syndrome. Prenatal factors. Exposure to environmental toxins, infections, or substances like alcohol, drugs, or tobacco during pregnancy can increase the risk. Maternal health conditions, complications during pregnancy or childbirth, and prematurity are also factors. Birth injuries, traumatic brain injuries, oxygen deprivation, or complications during labor and delivery can lead to developmental disabilities. Medical conditions, illnesses such as meningitis, encephalitis, or lead poisoning during infancy or childhood can cause developmental delays. Environmental factors, adverse childhood experiences, poverty, malnutrition, inadequate access to healthcare or early intervention services, and other environmental factors can impact development. Brain disorders or abnormalities, structural or functional abnormalities in the brain can interfere with normal development. Exposure to trauma or neglect. Children who experience trauma, abuse, neglect, or adverse childhood experiences may be at increased risk. Early identification of these symptoms and understanding risk factors can help in providing timely interventions and support for children with developmental disabilities, optimizing their long-term outcomes and quality of life.